Hi everybody, I'm Dr. Qazi. I am a skin restoration specialist in Newport Beach, California. And today I'm going to go over a really amazing scar result after a single session. This is more than a year later. I saw this patient in April 2023, and I'm going to just resize everything so you can see it properly. It's a really amazing result that really showcases how sometimes you just have to be patient with your scars, because it sometimes can just get better and better over time. So I'll wait for a few more people to join and then really just go through this case really well. I'm going to try to fix the formatting issues that I'm having right now, and I'll just, let me see if I could adjust something really fast. Yeah, let's see if I can get this perfect. Okay, so let's see if I could get my result showcased here. So we're going to go through this case, really nice case, really a nice patient. She comes all the way from Atlanta, Georgia, and I haven't seen her in a while, so I like it because it's something that I hear so much is, when do you see results? So this patient, she told me she started to see the results really 1 year later. So it was like 3 months she was pretty happy, 6 months she was happy, but she felt that like by 1 year it was a lot better. So just something to pay attention to, because I think that one of the things that a lot of people don't seem to grasp, especially at if they go to other practitioners who make a lot of promises because they don't really necessarily understand the way scars work, that sometimes these things can take a little bit more time than people may expect. I'm trying to just adjust a couple things here, and hopefully I'll be able to see if I could answer some questions as I kind of adjust the image a bit more. So please give us a true solution. The true solution is really what we did with it, which is we do manual work right here. It's not about just doing one modality. It's not like just doing an energy device. I do multiple different tools, multiple different things to make sure that we can get amazing results every single time. And that's what I'm going to showcase for you, because it's really about how we do this is more manual, like with Subcision, with TCA Cross, with lasers, of course. But the laser is like just one tool in the arsenal. It's not like the main thing. It's not the only thing. It's just a part of what I do. So I want to just really emphasize that for people, because there's a lot of concern sometimes with patients, that they say that they went to someone and they told them that they can't do they can't do their scars because they're darker skin types, and they tell them that we have to use a laser and it's really too strong, and therefore you really just have to live with your scars. And I was actually told that. People said to me when I was going down this journey that they couldn't treat my face properly because of my skin type. It was like almost like my fault. Like I was saying, I don't feel like I had much improvement. I was saying that it was like, I did 6 sessions. I was doing like 6 of the Fraxel, 6 microneedling, and it was like nothing special. And they were like, oh, it's because you're skin type. And, just have to accept it. You have to live with it. And it was like kind of putting the blame on me, making it seem like I had, some problem with my face that was just incurable. I guess also like just insinuating that it's like a mental health issue. But really, it wasn't like something that was just obsessed all the time. It was just, I was trying to get better. I was trying to improve it, and I was hoping to be able to improve it to a realistic level. And this is it's done. It's achievable. You could do this. We are able to get there. This is a single session here 1.5 years later, and it's really nice, to be able to see this. If you find it annoying when I'm rambling, quote unquote, just feel free to log off. Like, you don't have to be on here, like, at all. Like, I'm giving you, like a lot of ideas here for how to treat scars and things like that. But I certainly you have to be kind of just more respectful in the chat. because like I'm under no obligation to really do anything really. I'm happy to help with people that want help and want to improve themselves and get better and better though, to be honest with you. And those are the patients that I gravitate towards, and I want those kind of patients to come to me. So if you are the kind of person who is like impatient because I'm talking too much, then scar treatments aren't for you either, because you're probably impatient in life, really. And these things take a long time, really it does. It's like there's no way around it. So it's like, this is sort of like, think of it like a test that like, if you're like impatient and you can't handle me like talking about like what I talk about, then like this isn't your world. And you should just accept your scars and try to find someone who doesn't talk too much. And good luck with that. Yeah. Well, if you're very impatient, B, this is like 100% not your world. Like just 100% don't do scar treatments, or don't do really anything aesthetic, because you're just never going to be happy. And there's a lot of people that are out there like that. And it's like, you're never going to find happiness from someone like me. Never going to find happiness from any of these type of things. Just like patience is just like one of the biggest things. Thoughts on Rejuran S? I don't hear great things for scars, especially these kind of scars. I think that it's, maybe a temporary type of effect. I've had a patient that recently she did it over in Korea. She said several times, and she's a Korean patient. I think it was from there, and she came all the way over to me, and she was saying that she hardly had any results from Rejuran, and she felt that actually there were some lumps, actually interesting, I thought, from there. Noon is asking, hi doctor, can you fix acne or damaged scars? What about plastic surgery scars? Yes, all those scars we can improve. We can always improve those things. And what we did for this patient, I'll go through this case now that more people are on here. So essentially what we did, this is a single session result at 1.5 years later. So the first photo is from April 2023, and the next one is December 2024. And with this patient, we ended up doing a few things. We did subcision. So we did, in her case, actually, I used a pronged, something that's actually something called a tulip, or sometimes people basically just use it called a fork. And so we did that, and we actually broke up the scar tissue there. At first, I did blunt cannula, but I found it was really, really thick. You could actually see where all that thickness is. It was really tight, really thick. So I needed some special tools there, and I felt that the blunt cannula was not going to be enough for her. So that's why what I ended up doing for her was I used this tulip in certain select spots to actually break up the scar tissue. Also used a Noker needle, also did some excisions for her as well. And then you could also see where it was really thick. I actually did fully ablative CO2 for that. And so that ended up working out really well for her. And then, of course, TCA Cross. And, this is, it's a really incredible result. And then what we did was through the laser channel holes, we actually put a dilute form of calcium producing product called Radiesse in this case. So that's what we ended up doing. Do we take Bitcoin? We are going to be able to do next year, actually. Yeah, we will be able to. Our current platforms don't do it, but we will be able to do that. We had a lot of patients request that, so we will be able to do that actually next year. I don't have a diary saying my acne scars are so bad. I'll be happy to help you. I mean, that's what I do. That's everything I do. Well, like I do a lot of things, but like that's like, I do so much of every single day, and I'll be happy to help you out with that. Chris is saying there's a lot of cheaper options in the $100, $300 range. Chris, good luck with that. Honestly, I don't know what to say about that. If you think that if there's somebody that's showcasing these kind of results, and they're charging you $100, $300, run for it and do that, because like I would do that. Okay. If you think it's realistic and you think that's really real, like try that, I guess. Like I hope it's real. But I don't know, do you have any good scar treatments or dermatologists in Austin, Texas? I actually have a lot of patients over there from there, and they've done a lot of different treatments over there. I haven't really heard of anybody that does this at a very high level, to be honest with you, over in Austin. There's very few of us in the world, and I would say that I can't really say somebody that I know of offhand. Does microneedling and microgenesis help? Not really, especially not for these kind of scars. If you have these deep, thick ice pick scars, microneedling is not going to help for those kind of scars. So I would not recommend that at all. And Genesis is really very, very mild. It's not going to improve this much at all. So anybody trying to sell you that, trying to sell you a package of that is, at best, just ill-informed. At worst, potentially scammers. I guess I'll leave that up to you to decide if that's the case. But really, they should never be pushing microneedling for these kind of scars. Really inappropriate. And I hope that you guys become more educated and understand that there's a lot of better options here. Uzma Sanchez is saying, hi doctor, do you remove melasma? If so, how many sessions? Yeah, we do a ton of melasma. I have been doing it for about 7 years. Excellent, amazing results. We've done probably close to like 14,000 patients for melasma and their hyperpigmentation. I don't remove it completely because it's impossible to remove completely, but we have great ways of suppressing it, and it stays suppressed, so it works really, really well for that. Take a look at my page. You'll see a lot of different options. Mostly what I do is with the pico laser, but I combine that with certain types of topical medications as well as oral medications if needed. It just depends on what we're looking at there. Why did I do 2 rounds of Accutane? I did 3 rounds of Accutane, actually, not 2. I did 3 rounds of Accutane, and I had just terrible acne, and it was resistant. I had a lot of oily skin, like very, very oily skin. And so it was like better each time, but I definitely, I was talking about that a couple days ago, just the side effects that I ended up having, especially by the second and third time, had a lot more side effects, like by far, by second and third time, it was much more. But ultimately solved my cystic acne. You know, it was just one of those things that I needed to do because there was no other option. We didn't have lasers to reduce oil production like we do now with like the Cure laser, for example. What helps reduce pore size? So difficult because it's really more of like an oil control issue, and over time it does get a little bit dilated. But you could do things like just topical retinoids are easy to do, something just to incorporate anyways. I don't know if you're necessarily going to see much of a difference with it that way though, to be honest with you. This is amazing work. How do you choose between Radiesse, Dilute, and Bellafill? Good question, really good question. So it depends on what we're trying to achieve with the skin. If there is more laxity or just looseness in the skin, then I usually go with more with Radiesse. If it's more like I want to support individual scars, then I use Bellafill. If there's a lot of volume loss, like big chunks of volume loss, then I'll do like something like Sculptra or Fat Transfer for that. It sort of just all depends on what we're looking at right there. Did you used to have deep ice pick scars? No, mostly my scars were actually rolling scars and boxcar scars. And still a little bit, I still have some of those boxcar scars still remaining. Eventually I'll have to polish that off. But the rolling scars really improved quite a lot with some Subcision and Bellafill. So all the lasers that I did, like I said, I did 6 sessions of Fraxel, 6 sessions of microneedling, did nothing for my skin at all. Maybe it helped a little bit with the texture, a little bit. It definitely helped for like a couple weeks, maybe like a month. I was super happy when I first did it. It was like really painful, to be honest with you though, really, really painful. The way they did it was just like a topical numbing cream, and then they just washed it all off or whatever, wiped it off. And so as you wipe it off, and then they're doing the laser on one part of my face, and then the rest of my face, it felt like the numbing was already wearing off. It was so painful, I remember. And lasers aren't the solution for these scars anyways, especially something like Fraxel laser is not a solution. Microneedling is not a solution. So anybody telling you that, it's not accurate, it's not appropriate really. The Cushman is saying, how far are you booking currently for acne scarring? Well, we do consultations all the time. We do work a lot. I mean, I as long as I have the energy to, I do it. So we have extra room, but I think it's probably until like mid-February or so, or I can't remember offhand, but I think that's what they were saying. But there's always somebody needs to move patients around for cancellation, things like that. And so feel free, you could go through my page, go to drqazi.com, and then you could be able to book it directly on there. And then my team will reach out. Yes, we're in Newport Beach, California. So we're just like 5 minutes away from the airport. Usma Sanchez saying, doctor, for melasma treatment, is it laser? I tried all kinds of creams. I visited a few dermatologists. They gave me creams that end up burning my face and make my dark spots darker. Yeah, part of it is sometimes I use basically a pico laser, and I also use sometimes, if there's a lot of vessels there, I'll use a vascular laser like XLV. So I use both of those actually, and that ends up working really well. What did I miss? You missed how we did this treatment. Basically, this is a patient, this is a single session treatment right here, 1.5 years later. And she comes in from Atlanta, so you can see just amazing improvement. She said that it really started feeling a lot better for her skin about 1 year out. And really, this is amazing, incredible improvement. This is a Hispanic female. She is Actually, she is a Fitzpatrick 4, but she does have a little bit of melasma, so I treated her as if she's a Fitzpatrick 5, and we had to be very careful with her skin. You can see actually we did not cause any pigmentation issues for her. In fact, her pigmentation actually got better, and there's reasons why I do that way. Why was it raised? Good question. So actually, that's one of the big things I wanted to showcase for this, which is that in the medial part of the cheeks, those are areas where you, especially if you have ice pick scars, it could take a little bit longer to improve those scars, but there's a lot more tension because patients smile, and as they're smiling, there's a bit more where the scars stretch out a lot more. And so that ends up happening over years and years. And sometimes the scar gets harder around those edges there too. So that's what you're looking at with this over here. So that's also why you can see the medial part of the cheek where the nasolabial fold is, that part is there's still those scars right there. You can still see those little tiny ice pick scars. No, they still smile, but like, I mean, the point is that it's an area you can't freeze, you know, like, I've had patients where it's in the temple scars, and if we do Botox there after we do treatments, it's excellent because we froze it and then we no longer have a problem. Especially also in like the frown area, we freeze that relief with Botox or Dysport, and we do that over the course of a year or so, and now there's less tension there. The scar heals really beautifully over time. The smile area, the smile line area, you can't do that. What are you going to be able to do? You're just going to stop people from smiling. It's just not possible, right? So it's like instead, we just have to be patient with it. There's still ways of improving it. And today what I ended up doing for her is I did TCA Cross. I did ablative laser in that medial part of the cheek. So near the nasolabial fold, I smoothed that down really, really well there. And worked out incredibly well. Hi, Alan. Look forward to see. Are you coming tomorrow then? I can't remember if you're tomorrow or next week, actually. And someone was correcting me about that. I wasn't sure what day it was. Dr. Manisha saying, can this be cured with microneedling? No, definitely not. It definitely cannot. I hope you do not recommend that at all for patients, that this should be done with microneedling. These are deep ice pick scars. There's also a component of rolling scars. The scar tissue itself is incredibly thick, very, very thick over there. So I would absolutely not recommend that. Giuliano saying, Dr. Qazi, what do you think about the new study that says CO2 laser gives better results while on Accutane? I would agree with that. I would go lower dose with it though, but I do find that controlling oil production is critically important. It sort of depends though. Sometimes I actually like having sometimes a little bit of oil production afterwards, after we do the CO2 laser for like that first month. It gives us feedback that we just basically have to hydrate the skin a lot more. And if you're using Accutane, it may get overly dry then. So there's one aspect of it, but otherwise I do like a low dose of it though a lot of times. Or what we do is the Acure laser also works incredibly well. Big D saying, how many sessions of CO2 did you do for her? How's it going, Big D, by the way? This was a single session for this patient. I haven't seen her in a year and a half, so she came in and we did her second session today, right now, just a little while ago. So we did, in this case, we did TCA Cross. We did ablative CO2 laser on that big chunk, that big thick. Actually, what I'm going to do is I'm going to zoom in over there so you can see it properly. That really, let's actually fix this a bit. 1 second here. So what I'm going to do is I'm going to zoom in so you can see a little bit more of those scars. And I'll just hide that text for a second here. So you can see this, look at that. So I think you can kind of better appreciate this when you see just the thickness of the scars. And you can see what we had to work with, what we were dealing with here. Look at that. That was very, very thick. And that required ablative CO2 laser to smooth that down. It took a lot of work, and you know, it's timely. And that's why it's sort of like somebody's on here saying that people charge only $100 or $300. I don't, you know, so, okay, but I spend a long time doing this stuff. I chip away at this over and over and over again. I've never met anybody who does it that way. I will just keep on chipping away at it, keep on chipping away at it there. So it's like, you get, you know, I don't know if you get what we pay for it necessarily, but because I don't think we're unreasonable, but at the same time, you know, I think you have to be kind of skeptical of someone like that that claims that they could do this for so low of a price, because this takes a lot of work. It takes a lot of time, and it's like I just sit there and do it over and over and over again. And the good thing with me is that I find it super fun. But there's a lot of people out there who do this stuff and they hate their jobs and they're just doing it for a paycheck or something. And I don't know what they're doing, but like they should pick another career in life. But like, or like, there's a lot of different things they could do in medicine. I don't know why they're doing that though. But like they just, like, you can tell they just like they hate what they're doing. And it's like, you know, I see some people like they're doing like TCA Cross with like a toothpick with like bright light, and they're like doing 2 spots like that, and they call it a day. And it's like, clearly, like, you don't, you don't want to take ownership of your work. You don't want to appreciate your work enough. And it's unfortunate because now the patient's not going to get the best result there. And if you kind of let them do something properly, I feel like you could have done it, done a better job. Like sometimes if you just keep on doing invasive procedures like subcision, you could be causing scar tissue on them. So that's why I try to do it on our single session. As much as I could do on our single session, I'll do. And this is a single session result. It's a 1.5 years later. So that's why I was referring to you earlier that this is about patience though. This particular patient has a lot of patience, and she understood the process. She was very happy 3 months out, but she knew it was going to get better and better, and it absolutely did. So it's really important to be patient. And this is like, it's super critically important. And I want you just to understand that if you feel like you want like a rush type of result, you're so stressed and you really want to get that rush type of result, you have to solve the other things that are external that's causing you to feel like you need that rush, that's making you feel like you have to get it done at a certain time. Solve that before coming to me, because I'm not going to rush this. I'm not going to go dangerous on your skin and push it to a level that's unsafe for you. There's always a component where I have to make it safe. So it's like, I will always choose that over, the result. I'm super happy that we could get these results, but like at the same time, I'm not gonna like try to do something dangerous or reckless or cavalier just because you were in a rush to get your result. I'll try to do what I could do, but I'm not gonna rush that there. Dig D is saying, how do I figure out what I need done, Dr. Qazi? I told you what you need done. Whatever I said you need done, you need to be done. That's what it is. It's like, I only tell you exactly what needs to be done. If it doesn't need to be done, I'll not include that in the treatment plan. AMD is saying, do you recommend a green peel treatment? I'm not sure what that is. Green peel treatment. I've never heard of that. What is that? I don't feel like Googling it just right now. If you want to Google it for me, feel free. Audrey's saying, that's exactly my problem. I'm trying to calm myself, knowing it's a process and requires patience. It really does. I was actually thinking of putting this up there like this, but I decided against it. I was thinking of saying every problem has a solution, and like acne scars are a problem and it has a solution. There's a solution that is slower than you may expect, and it may not be like complete. So it's like, this is still a work in progress, but ultimately we could get there to your skin goals, as long as we are realistic though. So we sometimes have to adjust where you're going to expect. I tell patients, and I tell them all the time, I don't give you percentages. I don't say that there's going to be a percentage change. I don't even know. Maybe you guys can tell me what's the percentage change right over here. But you guys can say that. But I tell people that I want it so that's way less visible from a certain distance. Sometimes it's like, I see patients when you're waiting in the waiting room, I literally will like walk past and I'll see that from like 20 feet away. And 15 feet away, 10 feet away. And it's like, I'm trying to get it where it's only visible under like harsher lighting, if we could do that, if we could achieve that. But that could take years of work. That could take a long time. It's not going to happen, just in a few months. It really isn't. And I never show, I know there's a bunch of people out there that do, and I wish they wouldn't. They're very, very unethical, because they show results that are just like a week later. They'll show results after like, like there's so much swelling and stuff like that. And anybody, like I had, like this patient's results were amazing like 1 week later. It's like ridiculous, it's like, it's a ridiculous thing that people will do, that they showcase results like, a week later. This is 1.5 years later. This is a realistic result 1.5 years later. So that's what I want to showcase for people, that's what this is for. That's what we could achieve. It's possible. This is a patient, again, with melasma. She's a Hispanic patient. She's in her 40s. So, it's a difficult case. And she was done microneedling. She was doing microneedling a bunch of times, a ton more times. And, somebody's saying that they see probably 70 to 80% improvement. I think we're going to get even pretty close to that too, if we were talking about percentages. Because after today's session, I'm really comfortable and confident saying that I broke down a lot of that middle part right there, and we're going to get better and better results. So I think it's going to be awesome. Joey's saying, do acne scar treatments also treat post-acne redness? If it's relatively superficial, it may, but it may not also, because it depends on the depth of those vessels. I'm not entirely sure. ACs is saying, what would you recommend for not indented scars but hyperpigmentation after Accutane? So you could try Eucerin's anti-pigment cream, and then also you could do sunblock. So do those things. I think that's probably the best combination. Do you ever have patients who get little to no results? And it's tough to say. I think a lot of times it's early on when they sort of complain about that, where it's like, oh, I don't see enough result. I agree that it may have been a little bit slow. And I'll tell you that I'm very honest if it's like, okay, it is a little bit slower and maybe we have to do something else to jumpstart it or maximize it. But a lot of times we follow back with some of these patients like 6 months, a year later, and it's much better. And so I think people just sort of jump at this like within a month or so, and they're saying, okay, well, there was swelling and it looked really good, and then the swelling went down, and how is it going to get any better? Well, this patient, she's one of the people that said that it got better over time. And I'm someone that knows it got better for my own skin. It's so often that it'll go and get better and better over time. It's not something that it's just like you do it and now this is the result and you're stuck with that result. And there's a lot of other things that we could do to improve your skin. There's a lot of other things we could, potentially just continue doing TCA Cross regularly. Like I said, be patient. There's a lot of people, especially like in the holiday times, that have so much stress and so much anxiety. And, one of my patients was saying that her mother, comments on her skin, is commenting about her acne and things like that. And she's like dreading the fact that that's going to happen during the holiday time. And it's like, it's terrible that your mom does that. I wish that she, instead of saying those kind of things, recognized or appreciated how much work, this patient was on so many different things, doing so much stuff. It's not her fault that her skin wasn't completely clear. There's ways of presenting these things. And it's like, people would just say, oh, I'm just a blunt person, or I'm from the East Coast. I'm like, come on, that's not an excuse. You could just be a decent human being. There's zero excuse and zero reason to be like that. You could still be blunt and honest. I think I'm blunt and honest, but there's a way to present it still. But when I'm being blunt and honest, I'm not putting someone down. I think that's the difference, actually. There's a way to be blunt and honest, but then the first thing some people do is they jump to putting someone down when they're blunt and honest, which is interesting, right? I think that's it's kind of an odd type of thing that their first thing to do is to actually put someone down when they see someone actually suffering. Kind of interesting. You could sort of then use the fact that you had scars and the fact that you had acne, use that as a way to separate yourself from those people. Honestly, this is think of it almost like you won at life because you have an easy way to separate certain people, and it's probably really worthwhile to do that. Hey Christian, by the way, how's it going? Thanks for joining us. Hopefully you're doing okay. What about keloid scars? Keloid scars are very, very different, and usually we don't just use high heat or energy for keloid scars. I usually use something more like a vascular laser like XLV with that, and plus I'll do something like a steroid injection plus or minus 5-FU. Those worked out really, really well. It does take a few times to do that though. It's not like a one and done type of treatment usually is either. Do you recommend using Derma Stamp at home? It's okay. It's not it's the worst thing, but for these kind of scars, not going to change too much. Big D saying, how do you plan my treatment just with a visit? Can you answer? Well, I saw your scars really well. I know your scars. I know your skin. I think you were on Accutane, so you may want to see me again. I'll double check to see if there's any changes. But of course, I saw your skin, and I always look under angled lighting. I'm looking at and double checking to see. I have a very good understanding of what's going to happen with the treatment and how I'm going to do the treatment. Sid is asking, what procedure did you use for this patient in the picture? How many sessions, and my thoughts on Morpheus 8? So this is after a single session for this patient. This is 1.5 years later. What we did was TCA Cross. We did excisions. We did subcision. And we also did ablative CO2 laser. And then we also, through the laser channel holes, did a dilute form of Radiesse for her. And this is 1.5 years later for this. And then when she came in now today, she comes in from Atlanta. We ended up doing more TCA Cross and more laser here. And again, through the laser channel holes, this case, I ended up doing a dilute form of Sculptra. How do I go forward? Just another visit. I'm confused, is Big D saying. I don't know, Big D. I can't remember if we gave you a breakdown for your treatments, but if you did, just use that and just book it directly. Otherwise, we will do a visit, another consultation, and we'll be happy to see you and make sure you're feeling really comfortable with going forward with us. It's totally fine. We'll be able to do that. Sid is saying, I need this, bro. I have the same on my cheeks. You have locations in Bay Area. No, I'm only in Newport Beach, California. And I have a lot of patients in the Bay Area, a lot of patients actually. They just fly in and fly out. So it's very easy. I'm just like 5 minutes from John Wayne Airport. Let's see here. User 65 is saying, use for an anti-pigment cream in place of retinol at night. Well, if you're looking for just like the hyperpigmentation, it'll help more with the hyperpigmentation, but the retinol is a good idea just as an anti-aging, and then also just renewing the skin. Of course, it'll stimulate some collagen too, but you could do both. It's okay. And maybe just a little bit irritating. So I would probably do more like the use for an anti-pigment cream for a few months, and then go into adding your retinol. Adapalene or retinol, usually adapalene, it's over the counter, easy, stronger, especially for oil production, works well for that. Sid is asking, can you fly the same day after procedure? I hear you can't be in the sun after TCA. True, yeah, you should be minimal with sun exposure, but you can fly in and out the same day. A lot of our patients, looks like Sailor Moon comes in and out of Arizona, and yeah, we're right next door to the airport, so people literally fly in and fly out. Just let our team know what time your flight is, and we'll work and coordinate that with you to figure it out. Most of our patients are from out of state, actually, most of our patients, so we definitely coordinate that. Let's see here. The Cushman is asking, in med school residency, did you focus deeper and learn faster than undergrad? How did you achieve this? Really good question, actually. That's a really, really good question. Yeah, I guess it's worth going into. I'll explain a little bit, because I know that there's so many people, I don't know if you're trying to go into med school, but so many people get discouraged when they go into undergrad and they're doing all these science heavy classes like organic chemistry and general chemistry, general bio and microbiology, or whatever else that you have to do, biochemistry. And it's like really daunting, and it sort of causes some type of anxiety and depression. It's unfortunate, because really it's like when you're doing this side of things, you actually don't have to worry about that. So, like, you really don't. Organic chemistry, like, I think that they do way too much of it. I think if you just did like a semester of just biochem, that probably would have been good enough. I think they say that they want to weed people out, but I don't know why you want to weed people out of medicine. I think that we should have more people who want to go into medicine, medicine. And everybody studies differently, and so like when I was undergrad, actually I majored in international relations. I did some science classes. I did do that, but I actually loved international relations. It was like more like my style. It was like very rational. It was like just logical. I didn't like organic chemistry even a little bit. Like, I hated it, actually. The labs, all that stuff was terrible. And so I wasn't sure about all that stuff, but then I went into, after that, I just spent a year in a post-bac program, and that's how I caught up on my medical school classes, which, by the way, is a really good route to do, by the way, which is a really, really good way of doing things. Just anybody who's in the undergrad world or has like a child in the undergrad and wants to go into medicine or do anything else, you should actually try to go into undergrad and achieve the best possible scores you could possibly achieve in your, like, the highest GPA you could possibly get. And sometimes that's not with these pre-med classes, just like do whatever it takes to get the highest GPA you possibly can. And then what you could end up doing is then you could actually ultimately do a post-bac afterwards. And look at G saying she did a post-bac in psychology. Sid is saying organic chemistry single-handedly made me switch majors and go into tech. So many people it happened to, and it's really, really unfortunate. I just hate the fact that they did it that way. It's honestly, we could go into a whole nother talk about how undergraduate programs are just a scam. I think most people recognize that at this point. But it's ridiculous the way that they do that. It's like so many people are excited, want to be physicians, and it's why would we not want that? And we don't even do organic chemistry, so I don't know what they're talking about. Why would they insist on it? And then you go into med school, they say, oh, it's going to help you in med school. It doesn't help me in med school. It didn't help me a little bit in med school. So I think it held me back, because it's I probably would have actually focused on other things that would have helped me more in med school. So it's really unfortunate. And then when you go into med school, it's so memorization heavy. And so the people that excel, the people that like are right now pushing, for someone like this, they'll say, oh, this patient, she should do like 6 sessions of Morpheus 8. And they're like the people that were the top of the class, and they're like to this day, it's like they're the top of the class, and they memorized really well. They were like the people that sat there and they memorized. But they have a patient that was sitting there in front of them, and they can't really deal with the clinical side of things at all. They don't even understand how to manage patients, and they have terrible bedside manners. One time I went to a dermatologist, she didn't even look at my face. She was just looking and typing. She was just typing, type. And she was actually over in Northwestern. I'm from Chicago, so I was like supposed to be a great hospital and all that. And she's just sitting there like typing, and was hardly talking to me and talking to the MA, hardly even looked at me. And she had like, great school, great program, all that stuff. And like, doesn't even know how to deal with a patient right in front of her. And best part about it is that I was actually in med school at that time, and she still knew that, and she didn't even care. Like, that's how she was. And so, interestingly enough, so it's not about like sometimes these people that like do the best in their schools, to be totally honest with you. Don't feel like because you weren't doing great in school, you can't do things like this, or you can't achieve in your own field or anything like that, or like achieve something else, or try to change your careers or anything. Like, just don't ever listen to anybody like that. There is a way to do it. It's actually just takes a lot of willpower. There's a lot of willpower that takes to solve scars. That's actually what I talked about. Is this takes a lot of effort. It's a lot of concentration, and it's not for everybody. But there is something within your world that you could concentrate and spend a long time with, and you could do really well. And it's really, really fun. It's really cool to do that. So I hope you do that. I hope you actually find something like that, and you actually can enjoy it. And like, you could sit there and like every single day you do it. And when you're concentrating, it doesn't feel like work. That's like where I hope you could achieve. Do it. That'll be fun. How to get rid of marionette lines? Do Bellafill. Works very, very well for that. That works well. Otherwise, you could do just a little bit of hyaluronic acid filler, or you could actually end up doing, facelift potentially if it's really, really a lot of like deep marionette lines. Trevor saying, good seeing you on my For You page again. Just stopping by to say hi. Hi, Trevor. Thank you so much for coming by. Jim Dag is saying, does tretinoin help shrink your oil glands on face? Doctor says my acne isn't that bad for Accutane. Yes, it could. I think it would help with that. Player Girl is saying, can a phenol peel give the same result, which is more effective on this exact case? Well, if this patient was lighter skin type, then potentially, but these are more deep ice pick scars, so not going to help completely with that. But there was that element that I was showing earlier where I zoomed in, you can see again, where it's really thick, so the phenol peel could have helped with that. That's true, but I also saw that with the laser. And since her scars are mostly concentrated, it was like almost entirely just concentrated in this area, it's really tough to justify something like a phenol peel. I know somebody in the area who just throws phenol peels at so many different patients for mild scars, and it's they have prolonged redness, and it's I don't think it's appropriate medical treatment. I'm a little bit over time, but I'll answer a few more questions here. Divya is saying, does Morpheus 8 cause fat loss on the face? I think it could, especially if you're doing it to treat scars, because you're using a lot of heat, a lot of energy for these scars. Would not recommend it because really, yeah, you're using a lot of heat, and you're going down to the fatty layer. It is possible to destroy that. Let's see here. The Cushman is saying, thank you very much. Appreciate that. Will there be any discounts coming up for acne scarring or for the consult? We don't do any real discounts on that for sales like that for scars, but we do have things like for like Bellafill during the 12 days of deals. So you can take a look at that. If you're on our list, try to be on our email list and be on our text list, by the way. Every once in a while, we'll do something like that, just like what you could use for scars. Kotar is saying, thoughts on polynucleotide injections. I mean, in general, I think it may be okay, but I haven't heard like amazing wow results from anybody for scars. So I'm not sure if that's really going to be like a future for scars. Let's see here. Gabe is asking how many, by the way, how's it going, Gabe? Gabe is saying, how many sessions is this and how many months before and after picture? So this was, actually I'll lower this a little bit here. This was first session, one session, and it was, first session was in April 2023. And then she just came in today and we did her second session. So this was 1.5 years later pretty much for her. So we did one session and this is that result for her. And these are with ice pick scars, rolling scars, boxcar scars. We did excisions. We did subcision as well. We did ablative form of CO2 laser, fractionated CO2 laser as well. A few different things. We did a bunch of stuff with that, which, worked out incredibly well. So it's like, and she's a patient in her 40s. She had melasma. She's Hispanic female. And it's really rewarding to see this ultimately, because you could see that a lot of patients do ask, does age matter, things like that. In this case, this patient said most of her results were visible 1 year later. 1 year later. So just pay attention to that. That's exactly what she said. She said that to me. And entiendo español. So that's what she said, and my team was there. And so it's like, she said it in Spanish, and it's like, I understood it. So, okay, so here we go. Where are we at, though? I know I missed a bunch of questions here. Why do I always break out before a trip and important event? Maybe the hype of it. I don't know. It's possible. But if use a hydrocolloid patch, and use a little bit of a topical antibiotic. Usually, that could be like a solution for 1 or 2. But if you need like if there's more cystic breakouts, then you may need like an oral antibiotic just to clear that up. What do you recommend for cortisone atrophy to pop up the dent? Probably Belafil is one of the better options there. So I would recommend Belafil there. I know I missed so many questions here. What skincare products can I use to cure these acne scars? There's no skincare product that will. None. OZG saying difference between Botox, Dysport, and Xeomin. Botox, Dysport. Botox is basically like the OG brand, and it's like tried and true. Dysport I find is actually superior. It's bound to like a little bit of albumin, and in this case, it actually seems to last a little bit longer for patients. It also seems to kick in a little bit better. Xeomin is something that's not bound to anything. It works well, especially if you have like a Botox resistance, or you just want really like the pure product completely. So you get no resistance whatsoever. And what you were asking about mini tox, that's my technique really, so it can allow you to have a little bit of movement without it being completely frozen. Do you treat surgical scars on the body? Yes, we do. We do a lot of that actually, especially in this area. I do a lot with that. So I do a lot with surgical scars, and I'm happy to do that. Zacky Wacky saying how to get rid of nasal labial folds. Well, everybody has nasal labial folds, so it may be something that you just have to accept. But if it is really true volume deficiency, then something like Belafil actually works really well for that area. So I think that's probably the best option. Jillian's asking, I have folliculitis that is finally healing on my butt. What do you recommend for scars? You may want to do, I had another case like that, very similar. What I ended up doing is Belafil as well as laser really. And it depends on also if there's pigmentation. We may want to solve the pigmentation. Sarah McGill is saying, this case is showing how much does that typically cost for all these things you mentioned. I can't say particularly for this particular patient, but most patients about $5,000 to $7,000. If they need more volume, it could take a little bit more, than the cost could go up for that. Divi is saying, I have hormonal acne. I do not want to be on birth control. Will my acne come back if I take Accutane or spironolactone once I stop the medication? Yeah, your hormones are going to really still fluctuate. So it's possible up until really your postmenopausal that you may have to be on spironolactone. But it's a well-tolerated drug. Consider that. Spironolactone is a good drug. Shiraz is saying, how much does cost the procedure? So again, $5,000 to $7,000 for our scar treatments. Most patients spend between that. Go to our page at drqazi.com. You can get a consultation. Our consultation fee is going to go up next year. So even though we're booked for this month, feel free to lock up the price by just scheduling it. You don't have to actually get you'll basically check it out, and then my team will schedule you in whenever the next available is there. What is the next step after tretinoin? Are you saying for acne or for scars? I guess I'm missing that. Your thoughts on icing the face and neck? It's, I tried that actually before too. It's not bad. It's just a really temporary effect just to help reduce the puffiness, but I don't think it's going to change too much. Do you do things like fat reduction in the lower face? Yes, we do buccal fat removal, and then we also do, I was talking about that yesterday actually, but we also do it where we do skin tightening as well. So we go internally, heat and contract the tissue afterwards. Jillian is saying, thank you. I have a question for my friend. She has cystic acne healing. What do you recommend skincare wise? Are you saying that she has cystic acne or she has the scars? Kind of clarify a little bit more for us. What product do you recommend for this pick? This is not a product, this is more of a procedure. This particular procedure, what we did was TCA Cross, we did Subcision, we did ablative CO2 laser as well. So we did a few different things with this, and then plus we through the laser channel holes, we put a dilute form of a calcium-based product to stimulate collagen. And this was after a single session 1.5 years later. So hopefully that answered all of those questions. What is my skincare? Actually, I'll show you guys at some point. It's pretty simple. I use mostly just moisturizer, sunblock. I use a pigmentation cream. Plus or minus, sometimes I'll use a bit of tretinoin, usually in the summertime. If I'm feeling my skin's a little bit oily, I'll use a little bit of tretinoin like on alternate days. But that's typically all I do. I try to keep it very, very simple. And I also use our hypochlorous acid spray, by the way. So that works out really, really well. Honestly, those are like the things that probably are the most important for us. What's the tightening of the skin again? So there's something called face tight. That's probably what you're talking about. What we were talking about yesterday, which is face tight and neck tight. You go inside, heat the skin, contract the tissue. It works really well for that. And overall, like it's incredible because we could actually go in areas where, like in the neck, to just heat and contract the tissue over here to make it tighter. You let him is saying, I did TCA Cross 70%. What can I use to reduce the hyperpigmentation? I think it's tough because someone has to see how deep that pigmentation is, though. There may be pretty bad deep pigmentation. You may need to be on hydroquinone. Otherwise, you could try to use we do have a pigmentation cream on our website, so feel free to go through that one. It works very, very well, so consider that. Otherwise, we'll take a look and see what the best options are for you. Lily's saying, I didn't read your comment. Was that comment about marionette lines? I answered that already. Marionette lines, do Belafil. Belafil works really well. You can do hyaluronic acid filler. Those are probably the best options. But Belafil is probably by far the very, very best. And then the other thing, if you have a very, very deep marionette line, consider doing a facelift or a neck lift. Caesar's saying, I did a halo treatment 1 month ago, but scars look the same. I mean, it's early anyways right now, but I think that you really should do more of something that's like less laser heavy, and talk to someone like me who's going to be able to do more like TCA Cross if there's deep ice pick scars, maybe Subcision if you need to do that, if you need Belafil, things like that, or all those are better options than that. So I would not recommend necessarily something that's like a lower level laser like Halo. Probably not going to change too much there. What do you think of buccal fat removal? It really just depends. It has to be the right patient. It really does. I think there's a lot of people that aren't like the best. I think that there's some people that are relatively skinny. Some people are people who needed that fat, but there's a lot of other people, and we will only do it if it's the right appropriate candidate, who do have this bulge in the lower part of the face, its fullness, and we will take out that piece of fat, leave your good fat there, and so you get a beautiful contour then afterwards. So I definitely would recommend it for those patients if you're trying to do that, especially if you want to avoid like an overfilled face. Some people, what they do is they overfill like the cheeks and the jaw in order to hide the fullness in the lower face, and it ends up looking really unnatural just really, really quickly. So I think choose the person you're going to pretty clearly, and don't let anybody over inject you. Thoughts on dermabrasion for scar treatment? It works really well. It just depends on your skin type. It depends on the kinds of scars too, how thick it is. Shami MD is saying, can you do fat transfer filler in the forehead area? Yes, we could. We usually do it, especially for scars with subcision. So we'll break up the scar tissue and we'll do it together. Divya is asking, do you recommend fat transfer with subcision so the scars don't tether back? I don't believe that scars really tether back. I don't really believe it. I think that people just didn't do effective treatments for it. It's maybe if they had new acne and then they caused new scars potentially, but this patient as well, it's smooth. It's smooth in there. So it's like, I don't believe that scars retether. I think that they just didn't use the full tools in the arsenal to break up the scar tissue. So if that's done, if that's missed, okay, like maybe it was a safety reason, things like that. But I think it's unfortunate to insist that it's because of retethering. And I think that people that are saying that, they really should prove it with imaging. that the scars are retethering. I don't think so. And maybe they should work on the way that they did their subcision, you know. But I do believe that there's a lot of times with rolling scars, you do need to do some volume, and that's why a lot of patients you'll find that after you do subcision, there's still indentation there, and that's not as retethered. It's just that there was a pocket of fat that was destroyed, and you have to do something for that. Can you sculpt high cheekbones with Sculptra instead of filler? Yeah, absolutely. Sculptra is awesome for that. You absolutely could. It's just that the way people do it a lot of times is too superficial. I actually go down to the bone and I do Sculptra there, and it works out really, really well. It gives you a lot more structure, especially if you're trying to work on enhancing your cheekbones features. Yes, that's how I would do that. So you absolutely could do it. You could also even consider doing Radiesse. Radiesse swells up a little bit more, but it could work on that. I'm getting another question for our prices. Go to our page at drqazi.com. You'll see our prices on there. Most patients for scar treatments are spending between $5,000 to $7,000. If they need more volume, it could take a little bit more. But you know, that's usually what we do. Hi, Miriam, how's it going? I know you're always asking for new scar results, so here you go with one. Because we didn't do too many this week, we're showcasing some other things. And but I always appreciate everybody that comes on for scars, so I always want to showcase that for you, and you guys could always see the different things that we could do for it. You know, I do 3 cases a day, but like, so not very few patients let me share results, you know, and so it's like I always am happy, super happy when patients do. And this patient, she flew in. I hadn't seen her in a long time. She comes in from Atlanta, so it was really nice to see her. Do you do thread lift for the face? You know, it's a good question actually. I would do it only in a very, very select patient. I am not a fan of it in general though, to be honest with you. I think you run into a lot more complications than it's worth. I think there's a lot of better options. Bellafill is a great option. I used to do a lot more threads, and I just found that like I was doing, a lot of people in my area were doing threads, and they don't do subcision. So I was fixing a lot of the barbed threads were stuck, and I had to actually end up breaking up the scar tissue there. And I was like, I was like looking at this, like, is this really worth it for people that, you know, they could potentially have a very serious complication? And it's, you know, unfortunate that a lot of people were doing things without knowing how to fix those complications too. Because it's like, you know, if you're doing something, you really should know how to fix it. Otherwise, probably don't do it. You know, I think it should be a basic rule. If you're doing like a procedure on someone, make sure you know how to fix the complication of it. And it's like, a lot of stuff look easy, like filler looks easy, all that stuff, but a lot of people don't know how to do the complication of it, don't know how to manage it, don't know how to deal with occlusions, don't know how to look under ultrasound for those things. So best spot to do Bellafill, you could do it almost anywhere on the face. The places that you just, or even the body, places you would never do it though on would be the lip area. I just would never do it on the lip area, or above the lip. Mostly I would not do that as well, but pretty much everywhere else, just be aware of that. And actually it doesn't make much sense to really do in the neck either. I wouldn't do it there either. So, but it's pretty much everywhere else is okay. And you guys know I have a lot of Bellafill. I love Bellafill. I use it all the time. It's amazing. You know, I started it like 7 years ago or so. It's like awesome. I went overboard tonight. I'm gonna kind of wrap up. Just a few more like pressing questions if you guys had, because I'm done for this week. I may come on a little bit tomorrow night. We're having our Christmas party tomorrow night, so I may just come on, and you'll meet some of the team actually too. So maybe I'll see. I don't know what we'll be up to tomorrow, but it'll be our staff Christmas party tomorrow. And last year I came on at that time, so maybe I'll do it again. Actually, I've done this now for a little more than a year. And you know who's been on here since about a year? I know Miriam's been on here. I know, yeah, exactly. I know you were on there. Who else has been on here since that time? Who remembers that Christmas party time? It's awesome to see you guys on here again. But I think that there's a lot, there's a lot of probably people. But yeah, I think a few of you guys, I know that Alan was on here too at one point. Maybe some of you guys, some of the East Coast people that are sleeping now. But yeah, it's pretty cool. And by the way, where are you? What are you on actually right now? Where are you guys? Where are you guys located, by the way? So I could just have a kind of running list of where people are located from this. What was done for this patient while we're waiting for that, for everybody to say where they're located at. We're in Canada, like kind of giving the cities though, so I could get some general ideas there. And for this patient, we did TCA Cross, we did excisions, we did subcision, we did ablative CO2 laser, and through the laser channel holes, we put a dilute form of Radiesse in there as well. It's a single session, 1.5 years later for this patient. She came in today. I did more ablative CO2 laser. I did TCA Cross for her today, and a little bit more of that dilute. In this case, I used a dilute sculpture for her. Seattle, Michigan, Los Angeles. So some of you guys are actually on Central Time. Australia, I'm not sure what time it is in Australia right now. Winnipeg, someone else is saying Seoul, Korea. Hopefully everything's okay in Korea now. That whole thing was pretty crazy that happened over there. Pretty concerning. Maha is saying, hello doctor, love to see you live. I would like to ask about BBL laser. I've seen lots of derms talk about it. Is it worth it? It's awesome actually, for the right patient, for the right situation. So yeah, in Dubai, awesome. So yeah, actually it looks like a few Dubai patients, people on here. So cool. Awesome. Yeah, I like the fact I had a patient that was my first patient from Nigeria the other day. Was scheduling chickenpox scar. I'll show that maybe next week. I had that result before. I showed that before, but I'm going to. If there's anything else that's I'm from Dubai and Houston. Oh, really? Okay, perfect. So that's pretty cool. Is there anything we can do to prepare for the consult? Yeah. So a few things. Take photos straight. Take it like a little bit of like a quarter shot, and then take another one like completely on the side, and try to do as close to like harsh lighting as you can. So if you have like a window of sun, try to go and do some of those photos on one side with the sun facing your skin on one side, and then flip over and do it on the other side, especially if you're trying to do scar, if you want to do scars. Otherwise, just take angle shots for things for fillers, things like that. That's no problem. Shama saying, are there creams to remove scars? No, I mean, like retinoids could help a little bit, but it's not going to remove scars though enough though. Diana is saying, sculpture or Bellafill. Bellafill is excellent for small, like discrete scars. You want to put it in there forever. That works really, really well. Sculptura is like for big chunks of volume loss, works incredibly well for that. How much does this cost? $5,000 to $7,000. Go to our page. Go to our page, drqazi.com. We'll be happy to help you out with it. You can see our prices. Our prices are open. I could care less if people want to compete with these prices. I believe in collaboration and not competition. And some of these guys, they want to compete, but like I don't know why they want to compete, because I'm like sitting here trying to collaborate with everybody. But okay, yeah. So anyways, yeah, so feel free, you can take a look. Yes, does the sun foam light make scars worse? Yes, it does. What's my morning routine? It is actually not too much, to be honest with you. I use a gentle cleanser, I use vanity cream, and I use sunblock. That's it. All right, guys, appreciate you all. I will see you tomorrow. Not tomorrow, actually. I'm going to see, unless I'm live on my Christmas party. But otherwise, I'm going to see you next week.